Hello and welcome to Pain Management 101. This is the first lecture in a series of lectures that is focused on pain management. In this lecture, we will learn about how does pain originate in a human body, what's the pathophysiology of pain, and finally, what are some of the assessment and management options for the treatment of pain, and also how does compounding actually play a role in treatment of pain. So let's move on to talking about why should we actually care about pain. So Institute of Medicine is a non-profit organization that works outside of the framework on government. In 2011, they issued this report, and basically what they've done is they looked at the problem of pain as a public health, as a national problem. So they've conducted an investigation, they've collected different data, and what they actually found is that in our country, pain is truly a national problem. Every year we spend about $635 billion. And where does all of that money go? Well, about half of that goes towards the incremental cost of healthcare, and about half of that is due to the loss of productivity, people taking days off of work, sick days. So that huge number comes out to be about $2,000 for everybody living in the United States. So truly for us, relieving pain in America is definitely a priority. So $635 billion is a really big number. How do you actually put that into perspective? So this beautiful building right here, this is the hottest new real estate development. In fact, the top end houses actually retail for about $90 million is what I was told. So this amazing, incredible building cost its developer about $1.5 billion to build. So in essence, every year, if we're losing $635 billion due to costs associated with inadequate management of pain, it's like an equivalent of losing about 400 of these types of building every year. So what did Institute of Medicine say in their report? So what they actually said is that given the burden of pain in human lives, dollars, and social consequences, relieving pain should be a national priority. So notice or really put an emphasis on the fact that it should be a national priority. And all healthcare providers should keep their knowledge current by engaging in continuing education programs. Licensure and certification and recertification examination should include assessment of providers' pain education. So education is crucial for the proper management of pain. So let's look at some of the pain statistics associated with chronic pain. So about 116 million Americans live with chronic pain. That is a huge number. And more than 60% of US residents in nursing homes actually report pain. Arthritis especially is a very debilitating condition, and we will be talking more about it in osteoarthritis and rheumatoid arthritis lecture. And nearly 17% of the population actually have substantial daily pain. More than 1/4 of adults said that they've experienced low back pain. So low back pain is very serious and also needs to be treated with proper care. And then 15% of adults experience migraine or headache. So now when we look at chronic conditions, these are chronic disease states that you all heard about, for example, diabetes, CAD, coronary artery disease. So we always talk about cancer, we always talk about stroke, we always talk about diabetes. So you would think naturally that population-wise, these chronic conditions would predominate. But actually, if you see, chronic pain is the most prevalent condition by the number of sufferers. So we just talked about that. About 116 million Americans live with chronic pain, and this data is from Institute of Medicine. So not surprisingly, given that statistics, that the use of analgesic drugs, and analgesics are drugs that provide analgesia and pain relief, is actually on the rise. So what are you looking at here on this slide? So you can see that on this axis, you have all kinds of different drugs, for example, analgesics, anticoagulants. This is on this axis, what you're looking at, so this is a patient demographic from 18 to 64, and this is 65 years and older, senior citizens. So this is basically everybody, and this is seniors. And you can see that this represents two different time periods, and this is a percentage. So you can see that from 1988 to 1994 versus 2007, 2010. So the use of analgesics increased from 8.6 to 10.5 in this age category, and from 13.7 to 13.8 in seniors. So the bottom line is that we're now using more analgesic drugs. And if you look at this graph, what you're actually looking at here is three different graphs, and they all demonstrate essentially the same trend, that now we have a rise in a death that actually involve opioid analgesics. So this is from opioid overdose, and you see that for this specific graphs, the trends are actually they are equivalent in all different subpopulations. So for example, different ethnicities, you see the same pattern, right? The death arising. Different gender, male and females, you see the same pattern, that they're on a rise. And likewise here, you see different age categories, even in seniors. So given all of this information, it's not surprising that in some states, the death involving opioid analgesics are actually, such a troublesome concern that what the police, firefighters, and state government actually have done is they have put together this Narcan or naloxone kits. And what you're seeing here is naloxone. This is an opioid antagonist. It's basically going to reverse the actions of the opioids and hopefully save your life if you're overdosed on opiates. There's a syringe here, and then you see some alcohol swabs and some latex gloves so you can inject it. And these kits are the ones that police and firefighters now carry on themselves. So they're responding to the 911 call that's potentially related to the opioid overdose. Somebody is not responding or passed out, they can administer naloxone right away instead of, bringing the person to the hospital and losing valuable time. So this is Narcan or naloxone, and what you're seeing here is that it's basically an opioid antagonist that's going to restore breathing and reverse overdose. And there's about 60 pharmacists in Rhode Island that are actually under collaborative agreement to dispense it. And then finally, what are some of the barriers to pain management? So providers lacking gap. This is knowledge gap, training, and competency. And adequacy in subspecialty training, systematic and organizational barriers, and then depth of the problem. About 27% of PCPs or primary care doctors actually report being somewhat unprepared, and then 50% report being somewhat prepared. So education is definitely a must. Thank you so much for your time, and we will continue next in our next lecture with Pain Management 102.